Welcome to Family Awareness Talk Show. In this episode, we will talk about family health and how we should be aware of all the diseases and pandemics, precautions, and visiting the doctor's office. We will have with us inside the studio internal medicine doctor and head of medical department of Media School, Dr. Cinderella Hojeily, and on Zoom we will have with us family medicine doctor and pediatrician Dr. Dina Khromilova from Russia. Pediatrician, family medicine doctor Dr. Dina Khromilova from Russia. Would you please tell us about yourself, your major, and the decisions that you have made in order to work in this field, please?
Usually it's not I choose medicine, this is the medicine choose me. Because my parents, they worked very hard as a teachers, and after school I went to my grandmother's clinic. I spent evening there, so I'm always was in the situation and with patients, so I didn't even think about doing something else than medicine.
What are the common questions you are being asked by patients on a daily basis?
During the epidemic time or pandemic time, approach of course changed. We have to avoid gathering people in the waiting room by giving phone appointment. And we, between every patient, we have 15 minutes to clean clinics, disinfect everything, change mask, gloves, and coat to see another patient. This is the main approach. This is the main changes in the approach during this time.
What are the main issues that patients aren't aware of, especially in Lebanon?
Between Lebanon and West countries, of course, there are some pros and contras. For example, there is a positive things in Lebanon. For example, patient can choose a doctor, and availability of the doctor to patients usually higher. While in the West countries, you have to take appointment, it takes time. You might have appointment after 2 months after you actually asked for it. In Lebanon, again, if patient is not satisfied with doctor, he can easily go to another doctor, ask another opinion, go to another hospital. This is a big plus actually, but there is some underwater stones. For example, if patients choose many doctors and everyone give him medicine, the patient can finish end up with taking a lot of medicine which are incompatible with each other. So sometimes this patient come to you and they show you big case of medications that you see you taking all of this, yes, but they have interaction that you cannot tolerate. So on this stage you cannot know this is side effect of multiple medications or this is disease. You have to stop everything and start over again. This is minuses, but this is actually not such big minuses like in Western countries when the patient, the doctor just not available.
What are the tips you like to add to parents with regard to hygiene and how they should instruct their children who will go to the schools?
Difficulties here is lack of history, actually. It's difficult to acquire history from the patient. For example, the baby has a diarrhea. You ask his mother, what did he eat yesterday? Nothing. But further questioning, you realize that he bought gatto from local market, that he bought ice cream from the machine, so that they go and eat chicken sandwich from outside, or they go and if you eat chicken sandwich, it's maybe salmonella. If you eat hamburger, maybe it's Escherichia coli. So you have to know what exactly the history, and it's very difficult to acquire it. This is the main difficult point. And sometimes, it's not all the time, sometimes you face people they doing absolutely strange things, like trying to check benzene, trying to check benzene with addeha. Explosion happens, you have a problem.
What is your advice to the Lebanese people during COVID-19?
During this epidemic or pandemic, everybody has to protect themselves with individual protection, like masks, like our gloves, like you come home and you change your clothes, like you came home and put off street shoes and wear slippers. You wear slippers, and you should increase your immunity. If you are diabetic patient, if you have diabetes or you have the hypertension, you have to tight control of this disease. And if your sugar is very high, it means that you need to adjust your food. You stop eating sugars, you stop eating manaish, bread, and so on, because high sugar make your immunity low. So you are very corona will hit you very easily, let's say that. When people go to work, they have to go to work, they have to face this danger to acquire coronavirus. There is a simple things. When there is heavy rain outside, what will you do? You can stay home, or you can take umbrella. What is your umbrella in this situation? Personal protection, mask, gloves, and your immunity. The main point, increase your immunity by good food, by right diet, by stopping eating junk food like hamburgers and so on, salty food, which can decrease your immunity. If you immunocompromised, stay home. Who are immunocompromised? Patient who treated with cancer, patient who has blood disease, patient who has uncontrolled diabetes, patient who has uncontrolled hypertension. This patient a priori are immunocompromised. Stay home or tightly control your disease.
Dr. Dina Khromilova from Russia, working in Lebanon. Thank you so much for the precious information you have added to the Family Awareness Program.
You're welcome, Michael. It was a pleasure to talk with you.
Dr. Cinderella, you are welcome in a Family Awareness Talk Show.
Thank you.
Many people get confused between family medicine and internal medicine. Would you please tell us and give us the clear idea about family medicine and internal medicine and why people get confused?
All right. First, when you speak about any specialty, you speak about two fields, population and academic field. For family medicine, population, we go usually adult and pediatric for family. For field, academic field, it's usually outpatient clinic. So family medicine is usually an outpatient visit. So they don't go usually to hospital. You know, this is the difference. Now, when we go into internal medicine, it's about adults. They can see pediatric and geriatric, but it's usually we focus on adult. But the main issue, the main importance of internal medicine is that it goes into all details until you go into invasion. So you can, as internal medicine, argue with the cardiologist, the pulmonologist, you know, you can have input in hospital while family is outpatients. This is the main difference. Outpatient, inpatient, family has some more input on pediatric, internal is adult. So this
Okay,
is
do you think this is the job of the hospital, or this is like families must be aware if, let's say, if their child has a stomach ache? So would they go to a family medicine doctor or to the internal medicine doctor?
Yeah, inside the hospital, now we will speak about some rules. In the United States, there is rules that every patient has to go into internal medicine before getting any consultation. Internal medicine is someone guides you inside the hospital. If you have two, let's say you have a cardiology consultation, pulmonary consultation, and there is some conflict between. So the internal, and somehow we had a lot of such things, and at the last years in the United States we had also the internal medicine do some like multidisciplinary round, which means he gathers all consultations and he manages everything. He manages the case because you do have sometimes different consultation and different. One doctor may say NPO shouldn't eat. Another doctor may say, let's give him today this food.
Yeah.
We had some such cases in the hospital. So they got lost. So what's he gonna do to it? So then the internal medicine this is why it started to have a law. The internal medicine has to be before any consultation. Now, a family is more outpatient. If someone can follow a case outside the hospital before getting too much sick and getting into the hospitals. He's someone who shallow a family. You know, this is the family medicine, which is internal more into institution, hospital, and also he can follow any case, but when he follows a case, he follows it until even consultation. He can argue, because I can give you a lot of examples. You know, I changes the order of a cardiologist. When I refuse some orders of a cardiologist, and then he changes. He said, yeah, because the internal has the right, because it's not the case. So as internal, you have so much knowledge.
Yes.
You go into more years of study.
You know, doctor, during the COVID-19,
Yes.
since the time it has started and was spread in the United States and all the world, China, and even in Lebanon. So what I knew that all doctors, they changed their way of receiving patients. What the criteria that usually doctors follow these days?
Yeah. Actually, COVID changed everything, changed all institutions. Let's speak about doctors. First, we need to have more like somehow not quarantine place, but inside your clinic you need a place. It's aerated. For some, we didn't think about it before much. We didn't think about it. Even in hospitals now there is a place, a special place for those cases. So, and when they're gonna start the new hospital, they're gonna build a different way So COVID just changed the structure of a clinic structure. Even pharmacies, now you have, you know, those barriers, we didn't have it before. So it's kind of building a new concept, new structures, which is more healthy, let's say.
Does this put a burden on doctors?
Not burden. It's our hope. I'll tell you something. Before COVID-19, we had H1N1 epidemic in schools, and it was so high, like before, just a month before COVID. And I started having those thoughts before COVID. I went to schools and told them, you know, why they are staying too close to each other. Those students are so close. They're telling me what they're saying. Like, yeah, they are sitting it's too narrow, and this is makes a lot of contamination. And so I started doing aeration, and so even before COVID. Yes. And now it's now a rule to separate. And I wish myself to keep it. Not only in COVID,
yes,
keep it all the time.
You need the distance to keep distance between people.
Spacing.
How much do you feel that Lebanese citizens are cooperative in comparison with those in the United States, since you have worked also in the United States?
Yeah, you know, those results that we have in COVID, we saw that we did prevent. So this means that population, Lebanese population is not, you know, careless. They care. Now, I mean, some places, some urban places, maybe they didn't take care too much, but overall, we did well in Lebanon. We did good prevention, which is a sign of civilized people. We do have civilized people, not like, you know, not a word, but it's in Lebanon.
That's good
even
news.
Better than outside.
Okay, then you are talking about the positive side of like how much people are cooperative. What are the difficulties Lebanese doctors face, doctors in the United States don't face?
Yeah, thank you for asking this question. Actually, as internal medicine, we struggle in two things. We have outside, in the United States, we have a law that in hospitals that support what we call hospitalists or internal medicine that are in-house. And every consultation has to go into hospitalist before getting consultation. We don't have it here. We have in some hospital that I helped to build somehow a hospitalist service, but it's not so much, you know, in all hospitals and not well known yet. Another law, there is law also in Europe that every institution above 40 or 50 employees need an occupational health doctor in-house also. And believe it or not, they are doing now a committee and where doctors enter in the employment. So when you do interview, it's not only HR and doctor, the doctor has input in how health, if it fits the health, and also his mental, his attitude, and everything. He makes a note in the employment. So now it's the committee. It's here. Yeah, it's very new. We don't have it. Usually I speak it with a lot of institutions. I try to, but still, you know, in Lebanon we struggle in a lot of things. But this is the major struggle of internal medicine. And I tell you something that this is the basics of medicine in a country. So when you build an internal medicine well, you have good medicine overall. So this is what makes United States is a hospitalist. This is the basic. Well, you don't have it here. You have it minimum in somehow, but we wish to get it more and more.
That's good. You know, as we said before, that the world has changed and everything has changed. Like, you know, your lifestyle, even inside the house, has changed. Doctors have changed their way of receiving patients.
Yeah.
So some of the families don't want to accept the ideas that the world has changed after COVID-19. You know, it's not the issue of COVID-19 only. The hygiene level has to be raised.
Yeah.
And this is what we heard from many doctors, that we have to work on the awareness of a hygiene level at homes and at schools. What are the tips you would like to give to the employees who are going to work and getting back home, and to the people who are sending their kids to schools?
Okay. I think, you know, we went over those tips too much, like, you know, disinfection, masks, spacing. These are daily routine in whole organization. They always send it. And now the problem, I think the way we will need to take this into practical way is to make it as a habit. So that's what I'm saying. It's not just inside the COVID season. I want, you know, population to change by itself, and let their child get a habit to have a sanitizer with them, to wash their hands, to keep spacing, and make it as a habit. So they don't, you know, just now for this 2 months. No. Make it a habit. Let the child be having those as a habit. Preventive habit actually is a sign of civilization. And it's very healthy, and but you know, don't get into fear or into, but just go into habit and not a fear. Not, you know, I'm preventing because I'm scared. No, not scared, but prevent to be healthy and make it a habit. That's what I'm going to say.
Yeah, regarding habits, you know, Lebanese people didn't get used, like, take their shoes off before they visit friends or they come back home. Do you think, like, taking the shoes off before getting inside the house would prevent the families from many pandemics or diseases or any risks?
Yes, surely it does. Surely, so there is no question about it. Now, some people may spread alcohol. It's also an idea. Some people may. You know, maybe they have it in a closed area. They go into their shoes and they go. It's not. Those are details. But yes, taking off shoes because, you know, all the day you went into a lot of bacteria. It's not only COVID. It's a lot of things. It's good to either disinfect it or remove it.
Dr. Cinderella, thank you so much for being with us and reaching Family Awareness Program. We expect you with more episodes for giving us more guidance about family health. Thank you for watching us, and wait for us with more episodes about health. Thank you. Enjoy your day.